workers. It feels like everybody is sick or has been sick around this time of year, especially with the flu.
Yeah, Kansas City University Assistant Professor Dr. Grin is joining us this morning with what you need to know. Good morning, Dr. Grin. Good to have you.
Yeah,
Thank you so much for having me.
So let's talk about flu season, particularly this year. And I know a lot of things affect, the ups and downs of the season. Weather doesn't help. As you can see, the temperature changes and the big swings. Why are we seeing more people with the flu this year versus any other year?
Great question. So first of all, what is flu? Flu is a viral respiratory illness caused by the influenza virus. And every year, the strains of influenza that cause flu tend to shift a little bit. And it just so happens that this year, the strains causing flu are a little bit more severe, causing more severe illness and maybe making flu spread more easily. Another issue is that less people are getting vaccinated for the flu, and so that's causing more folks to get sick.
Yeah.
When do you think we'll be out of flu season?
The CDC is showing that rates of flu-like illnesses are starting to decline, so I think we're on our way out of this, but we're not out of the woods yet. You can still get flu into early spring.
And we've been having a lot of fluctuating temperatures kind of on a roller coaster. As you can see, we're going to be 76 on Tuesday. How is that impacting the flu and also other viruses that we're seeing, like RSV and things like that, and even COVID?
I haven't found any data that really looks specifically at the fluctuating temperatures and how that affects flu and COVID. So it is possible, and it'll be an interesting thing to study. It is possible, though, that the fluctuating temperatures are having some effect on our immune system that maybe makes us more susceptible to these viruses.
Yeah, well, like cold temperatures. Can the cold temperatures contribute to the flu?
That's a great question. I hear this all the time. That, I went outside with my wet hair in the winter, and that made me get the flu. The cold itself doesn't actually cause the flu, but the cold can create conditions that make it easier for flu to spread. So a couple things. One is that the flu virus actually likes cold, dry air, so that's its home, and it likes that kind of weather.
Interesting.
The other thing is that, in the winter, folks tend to be inside. They tend to be around other people more, just in conditions that it's more likely for viral respiratory illnesses to spread.
Yeah, and Dr., how can we protect ourselves? Because we're coming up on allergy season, and so for people who already have maybe, bad allergies or asthma, and we're still kind of in flu season, how can we protect ourselves?
It's kind of the same advice you're going to get for your doctor for any viral respiratory illness. So wash your hands regularly, cover your mouth when you cough or sneeze, get your annual flu vaccine. You can still get it even into March, and then get your COVID vaccine, or make sure your COVID vaccines are up to date. And doing those things really should help protect you both from getting flu or COVID and from getting more severe disease.
You study all the data out there, and we know that there's a lot of flu cases. Compared to years where there's been a lot of flu, how does this year stack up compared to some of the others?
This year has been a worse year for flu compared to other years, and we've had more cases of severe flu. And I think, part of that is related to the strains of flu that are circulating, but part of that's also related to vaccine rates. And, the vaccine isn't perfectly protective against flu, but just like with the COVID vaccine, it's going to help protect you from severe illness and from ending up in the hospital.
Yeah, and I know with COVID, you can be non-symptomatic. Is that true for the flu as well, or should you have some sort of symptoms?
It's the same, so some folks can be asymptomatic with the flu, but a lot of folks with flu will have more severe symptoms like fever, body aches, fatigue. It's a little different from the common cold too. So usually with flu, you're going to have more of those kind of systemic symptoms.
Yeah.
And do researchers know what type of flu we're going to be having next year already? And have they made any kind of announcement as to what strains might be prevalent next year?
They haven't yet.
Oh, they haven't yet, okay.
This is something they work on every year, looking at kind of what strains are coming and then hopefully preparing vaccines that will predict the type of flu that we're going to have.
Okay.
Yeah, all great information.
Yeah.
Where can people find you if they need more information or advice on healthcare?
So I work at Kansas City University. I'm an assistant professor of primary care there, and I see patients at the KC Care Health Center.
Awesome.
Awesome. Dr. Grin, great to see you. Thank you so much.
Thank you.
And watch